We are continuing our discussion on the coronavirus or COVID-19 pandemic. With new case numbers on the rise throughout the country and especially here in Florida, which has been dubbed the new epicenter by some, this leaves many residents questioning what they should do next. While we're still trying to return to some sense of normalcy, local attractions and other businesses are continuing to reopen. Face masks are now required throughout Orange County, and more testing sites are opening to accommodate the numbers. So, what does all of that mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor Jerry Demings to give us an update of what's going on here in Orange County. Mr. Mayor, thank you for joining us. The numbers do not look good here in Orange County. What is the latest update?
We are continuing to see the virus surge here within our community, but if there's any good news, the numbers are beginning to stabilize for the last 2 to 3 days. But we have now approached approximately 16,000 positive cases of the coronavirus here within our community. So that's very significant. To put that number into perspective, going back to June 1st, we had about 2,900 cases in Orange County. Here we are on July the 10th today, and we are approaching 16,000 cases. Sadly, I have to report that we also have now approximately 78 individuals who have died as a result of the virus. But we do see the numbers beginning to taper off somewhat. We believe that since the mandatory facial coverings order was put into place, requiring individuals to wear masks here within our community, we believe that that has contributed to the flattening of the spread of the virus. But we all have to do our part. We have engaged in a new campaign here within Orange County called the Do Your Part Orlando campaign, where we will have messages aimed at certain demographics within our community to get them to continue wearing masks, adhering to the social distancing guidelines that we put in place. So you will see some of the public service announcements on television. You'll hear it on radio. You'll also see it in some of our local newspapers. And so we're kind of targeting those communities that have disproportionate numbers, such as the senior citizen community, Hispanics and blacks who have disproportionate numbers here within our community.
And it seems like we are starting to see a lot more testing in different places. Tell us about testing efforts here in Orange County.
We're continuing to test throughout the county itself. This past week we tested at the Legacy Middle School, and we will continue to test next week at Barnett Park, and testing has been ongoing at the Orange County Convention Center. The Orange County Convention Center is the #1 testing location for the entire state of Florida. It is now approaching between 1,700 and 2,000 tests each day within the county itself. We're beginning to see our positivity rate begin to decline somewhat. The state of Florida's total positivity rate is somewhere around 10.6, 10.7%, and Orange County is just below that at this point. So we hope to keep our numbers low. We want individuals to have access to testing so that they can have the information by which to make good decisions about whether or not to seek treatment, etc. I think no one wants to walk around and be positive and not know it, because you continue to spread it to family and to others. So we are encouraging people to get tested in the community. There's also private testing sites that are available. You can go to True Health, you can go to Central Care facilities, and in many cases you can go to your own personal physicians and be tested as well. So we want to simply stop the spread of the virus within the community, and that's our ultimate goal.
And since we have what at least on the outside looks like a number of positive people, that is a large number. Is it time for us to maybe pause the reopening of some of the businesses and some of the places where people gather?
Obviously, any places where there are sizable gatherings, we have to be very diligent in order to stop the spread. But we can control the virus to the extent that we can by simply masking up and by continuing to wash our hands and by continuing to watch our distance. If we keep distance away from individuals and embrace all of those sanitary measures that have been recommended, we can indeed control the virus here within our community. We're going to have to learn to live with the virus. In terms of should we begin to shut things back down, I hope we don't get to that point. If we continue to see the numbers begin to slowly decline within our community, then we know that that may not be necessary. And the number one thing that really determines whether or not we can continue to keep things open is really our ability to control the capacity within our hospitals and our healthcare systems. And at this point, the hospital executives are telling me that they are well within their capacities. They have additional capacity. So it's not necessary at this point. Many of the individuals who are testing positive have minimal symptoms and don't require hospitalization. If that changes where we have a significant number who are now having to be hospitalized, then that's a crisis that we have beyond what we're currently dealing with in our community.
Two other concerns that are on the minds of lots of Orange County residents are jobs and housing. Are there resources for people who are feeling unstable during these times?
Fortunately, here in Orange County, we have been the recipients of Federal CARES Act funding, and we have established crisis assistance for individuals and families, and they can apply for that assistance through going to our website at ocfl.net /orange cares. On this coming Monday, July the 13th, we will reopen our portal so that individuals can apply for crisis assistance of $1,000 per individual or household. In addition, we set up an opportunity for small businesses to be able to apply for $10,000 grants. There's some eligibility criteria associated with that. That is a continuous process that is ongoing, and you can again go to our website at ocfl.net /orange cares to get information about how to receive the small business grant assistance. In order to qualify, it must be a business that has 100 or fewer employees, and it has to be a business that has not previously received the federal Paycheck Protection Program loan dollars beyond $50,000. If they have received more than $50,000 in assistance through that avenue, they will be disqualified from receiving funds from through this process at this point. Our goal is to assist up to about 6,500 businesses, and we're well on our way to being able to do that. So those two sources are great sources for individuals who need a little helping hand. And so hopefully those dollars will go a long way to assist people who are in that gap, I say, between receiving other funds from the state regarding unemployment or other special assistance that is available, and or going back to work and getting a job and having the paycheck or the income returned to their household. So we are trying to get our economy back going here, but the goal is to do it safely. So we want to make certain that even in this environment where we are reopening businesses, we want to do that in a smart and safe way with all of the protections that are in place so that we can continue to live and take care of our families as well.
And Mayor, I know that the Economic Task Force has been focused on recovery for businesses and individuals, but now are they starting to also add in the reopening of schools as part of that equation?
The schools are a separate entity here. They have their own elected governance body or structure, in which there's an elected school board chair and there's an appointed school board superintendent that reports to a school board. So they have the authority and the oversight for the Orange County Public Schools. They really have their own budget and funds to be able to manage that. However, the governor recently, through the Commissioner of Education, who directed that all schools, public schools and charter schools in Florida must reopen during the month of August. What the executive order did not do was say the specific date. He said that they must reopen in August. And if they reopen, they must have some options. Primarily, if they're a brick and mortar school and they reopen, then they have to provide in-person instruction for the students. There's an option, too, in which students can continue to enroll in the Florida virtual school process, which existed even prior to the pandemic, in which students can be homeschooled and they're enrolled in the virtual school environment. So most of their study is through a curriculum that is online. And then the third option that students will have is to be able to enroll in the Orange virtual schools. And with that, if they enroll in the Orange schools, virtual schools, the students they could be at home, but they have to be online with an instructor or a teacher for the same number of hours that the students who are in school would be engaged with an instructional staff or teacher. So those are the options that the students are going to have. The school district here within Orange County has not given a specific date at this time that they will reopen schools, but suffice it to say that date could be as late as August the 28th of this year. So that's next month. So schools in Orange County today, by order of the Commissioner of Education, must reopen during the month of August. So parents will need to prepare for that. Now, they have to do so with the review of the local health officer. And in that case, that is the State Department of Health at Orange County. And Dr. Raul Pino is the current health officer who has consulted with the district and reviewing their plans. Again, the goal is to get the students to return to school in a safe manner. It's not something that, as the Orange County mayor, I directly have any authority over in terms of whether the schools reopen and how they reopen. However, we have said to the school superintendent, Dr. Barbara Jenkins, we're here to be of assistance. And within Orange County Health Services, which is headed by Dr. Yolanda Martinez, we will work with the school district in whatever capacity they request to have Orange County Health Services also work with the district to make certain that they have safe reopening plans.
And Mr. Mayor, there are so many moving parts to this pandemic, and lots of Orange County residents are, in flux, and things are changing all the time. Would you have any words of wisdom to try to keep people encouraged and focused on what we need to do to get ourselves through this pandemic?
My words of encouragement is this, that we're going to get through the pandemic. It will not last forever. Until there's a vaccine or there's a cure, we will have to live with it. I got some good news today in that here within the next month or two, they will begin testing promising vaccines within this global market space that we're in now. And the metro Orlando area has been one of the areas that at this point has been identified as a likely testing location for the vaccine. What that means is that individuals who have tested positive and individuals who are willing to participate in the testing of the virus before it becomes widely available to the entire market space would be able to participate here within Orange County. So in some ways, our citizens, our residents, will be able to contribute to the solution for the entire world, and certainly for the entire United States of America. So that's a bit of good news for us. The other thing that I would say to our citizens as we move forward, I'm highly encouraged that there's a way for us to re-engage our commerce and to do it in a safe manner. Within the next week or so, the NBA is going to be re-engaging with competition amongst their teams. It would happen at the Disney, ESPN, Wide World of Sports, and their facilities there. The players are going to be in isolation for the duration of this current 2020 calendar year as they kind of look to complete the playoffs and ultimately go to the championship game. That isolation that the players are going to be put in, I'm going to call it a bubble. It is going to be an experimental type of situation at Disney, in which the players, the coaches, and the staff supporting the NBA, as they play the games, there will be no spectators in the audience, but they are in this very sterile environment, this bubble that will be, I think, an opportunity to showcase what we have here in Orlando, and perhaps even if they're very successful in being able to engage in that sterile environment, a safe environment, it will give all of us an opportunity to enjoy the entertainment of professional sports and perhaps relax, to deal with some of those anxieties that we've had now for a few months since we've been living under the period of a pandemic. And I believe that if there's any place on planet Earth where this experiment could be successful, it would be at the Disney facilities. And obviously, because the players will be in an environment where they're living there, they're playing, they're working, they're not going to be exposed to the outside world while they're in the competition. They're not going to be leaving, going back and forth to their homes. They're going to be right there at that facility. So in many ways, the different protocols that Disney has put in place is going to truly make it probably safer for them to be in that environment than they would in the general community at large, because of people not having the ability to go in and out, and they'll be very isolated. The players will be tested several times a week along with the coaches and the other staff, and they'll be using these rapid tests so they'll get results very quickly. And so the sterile environment should result in, I think, the type of outcomes that the NBA wants to see. Similarly, the MLS, the Major League Soccer League, plans to also re-engage with Major League Soccer games there for all those same reasons that we talked about, that the NBA likely will be successful with what they're doing. I believe the MLS will be successful as well.
Well, we appreciate you shepherding us through these very interesting times, and thank you for being with us today.
All right. It's always good to talk to you. I hope you have a good weekend and rest of the week and a good summer, perhaps.
Thank you. Thank you, Mayor. And we'll be right back with more. Stay with us. Let's get an update from our local medical professionals. And joining me is Alvina Achoo, Epidemiology Program Manager with the Florida Department of Health in Orange County. And thank you for joining us, Alvina. I wanted to ask you about the spike in coronavirus numbers here in Orange County. Do you think that it is attributable to either Memorial Day or 4th of July celebrations?
Well, it's hard to know exactly because there's such widespread community transmission that's going on right now to attribute it to a particular event. But we do know that there recently has been, some relaxing of social distancing measures and some return to public spaces and return to work for a lot of folks. And so we wanted to sort of get out there the message of some community responsibility, some personal responsibility for everyone to watch their 3 W's. So to wear their mask, to make sure they wash their hands, and to also watch their distance when they're out in public spaces. And especially when they're close to persons who might be vulnerable to more severe illnesses, more severe consequences from possibly getting a COVID-19 infection.
Excellent. And also, what is the key to reversing some of the trending that we've seen of the numbers going up? Is it contact tracing? Is that really helping to get those numbers down?
So it's really not one single magic bullet for everything. It's the concerted efforts that we're doing here, which is the testing, the development of the vaccine, and also these measures to help stop the transmission that happens from person to person, which is a collection of things, not just contact tracing. Contact tracing is just one part. And so what I had mentioned before about the 3 W's, which is taking the personal responsibility to break transmission from person to person, the wearing of the mask and the washing of the hands and watching your distance, that is one way to help break transmission. The contact tracing the focus of that is to break transmission from person to person. And so when we talk to people who have been positive and we request for them to isolate at home, that is to prevent them from potentially spreading it to other persons while they're infectious. And also the recommendations for quarantine for persons who may have been exposed, that is for persons to separate themselves so that if they develop any symptoms or if they may have some and maybe infectious before they actually start showing symptoms, that they don't spread that to other persons, particularly those persons who might be especially vulnerable to severe consequences from COVID-19 infection.
And so far, we haven't seen our hospitals at capacity. Actually, they've been managing it pretty well. But are there procedures in place for if we were to go to capacity or even past capacity with people who are ill?
So we have been working, the Florida Department of Health in Orange County and the Florida Department of Health has been working very closely with our hospital partners and our healthcare partners to plan and prepare for what potentially might be an increase in possible illnesses. But our focus is to not reach that point, which is why we want to get that message out there about maintaining a good social distance, wearing your face mask to break the transmission between yourself and other people, and then practicing good hand hygiene. So all of these measures, that's the contact tracing, the isolation, the quarantine, all of that helps when we prevent those infections, reduce the number of hospitalizations and reduce the number of severe infections, and thus keeping people out of our ICUs and really saving our frontline healthcare workers who are in the hospitals and in long-term care facilities and anyone who provides medical care for another vulnerable person.
Alvina, tell us about the vulnerable populations and people who are really at risk of getting COVID-19.
Right. So actually, you mentioned about people who are at risk for getting COVID-19. Well, since this is a new virus, everyone is potentially at risk. Since really the world has not seen this virus before, there's no pre-built immunity. So everyone is at risk, and that's one point I wanted to make. But also I wanted to say that there are some persons who are at greater risk for developing severe complications, and those complications could potentially lead to death. And so these populations are where we would like to focus and target our prevention efforts. And so those are persons who are elderly, pregnant women, persons who have immune compromising conditions, anyone who has some underlying comorbidities such as obesity, hypertension, diabetes, persons who have impaired lung functions. And we know these populations will be in our long-term care facilities. These populations may also live in group settings. And so our focus towards our prevention efforts will be directed towards, the biggest bang for the buck, trying to get the most decrease in transmission in those populations.
And also, there is a COVID response center. Tell us about that.
Right. So we are, with the increase that we've seen, we are getting additional resources to do these focused and targeted prevention efforts, like I had just mentioned. We just newly minted the COVID Response Center, which will be teams of case investigators and contact tracers, as well as specialists who will respond to potential outbreaks in group settings to help track those, get people tested, link to care, and also give prevention messages and guidance for isolation and quarantine.
It's so valuable to have an epidemiologist here to talk about this pandemic with us today. Is there anything else that you'd like to add and tell to the general public about what we need to do, what we should be doing?
Right. I really would like our community for us to gather to try to help prevent the transmission of COVID-19 from person to person. And so I wanted to emphasize again the 3 W's, which is the wearing the mask to break the transmission from person to person, good hand hygiene, so washing your hands often and appropriately, and also watching your distance, so potentially staying 6 feet away from persons when you can.
Well, Alvina, thank you for being with us today, and thank you for being on the front lines of this pandemic.
Thank you. I appreciate you having me and let me speak to the public.
And we'll be right back with more. Stay with us. Our next guest is Dianne Arnold, the manager of Citizens Resource and Outreach Division of the Community and Family Services Department for Orange County Government. And she's here to give us an overview of the CARES Act funding and how it can help families in need. Dianne, thanks for joining us. Can you give us an overview of the CARES Act funding and who it's benefiting here in Orange County?
So the CARES Act funding is benefiting a lot of people in Orange County. It was divided up into different programs to assist people. And one of the programs it was divided up into that will have a significant impact is the CARES Family and Individual Assistance Program. And that program, any Orange County resident who's been impacted by COVID can apply for funding, and that funding would assist them with $1,000 that they can use to try to pay rent or mortgage or any of the other medical bills. And the county allocated $36.5 million to go to providing that type of funding to Orange County residents. And we're looking to assist approximately 30,000 residents with $1,000 each to try to help them during this time of the pandemic.
That's great. And as it pertains to individuals and families, what are the eligibility requirements for CARES Act funding?
So you must be an Orange County resident. You must have been impacted by COVID by either having a reduction in hours or a loss of your job, furloughed, or if you work, maybe you worked 40 hours and now you're only working 10 or 20, so you had a reduction in hours. You do have to be an Orange County resident impacted by COVID, U.S. citizen or permanent legal resident. And if you meet those criteria, then you are eligible for the assistance, and you just need to then apply online. The main portal is online.
And so going online is basically all you need to do to access the CARES Act funding funds?
Yes, so we have opened the portal several times already, and it will open one more time as of right now, which will be Monday, July 13th. So the portal opening is announced by the mayor at the press conferences. It's put out on social media, and when it opens, residents just have to go online and apply. They fill out a very brief application, and they only have to upload 3 documents that are required for us to be able to assist them. And in addition, the communications team has on the website all of the required information, telling everyone how to do it, frequently asked questions to help, just so people know ahead of time what they need to do when they get to the portal and they try to apply.
So if someone were to apply for funds and get denied, should they reapply at some point in the future?
So if someone applied and they were denied, perhaps because they didn't submit all the documentation or their documentation wasn't legible or something, we send them an email that will say that they're being denied. And once they receive that email saying they're being denied, then they can reapply again for the funding, and they'll have some information about why they were denied so that they can make sure they upload all the correct documents and that they're legible the next time they apply.
And one more time, can you tell us where we go to get information about CARES Act funds?
So if you go to the Orange County website, orangecountyfl.net, the main page, and then we have a separate tab on there for CARES funding. When you click on, or for CARES, you click on the CARES tab, and it'll give you information there about all the programs Orange County is operating for CARES, including the individual funding. And so you just click on the individual funding, and it gives you information about documents that are required, how to apply, a link to the portal when it opens. All of the information is there to tell you what you need.
All right. Well, thank you so much for the information. Thanks for being with us, Dianne.
All right, thank you very much.
And we'll be right back with more. Stay with us. Well, we've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe, everybody.